Thank you, Jen. It's really wonderful being here today. It's wonderful to have an opportunity to speak with so many friends and colleagues. Harold, we are so happy that you are at the White House and you're going to continue to do the great work that needs to get done to get us to ending the HIV epidemic. And what I'm tasked with today is to talk about how HIV has changed the world within the 40 years of progress that we've made. And before we begin, I just want to start with a quote from William Faulkner about the past is never dead. It's not even past, because we really do have to take a look at what happened in the past with HIV and how we repeated that past in some ways for COVID-19. Now, many of you might remember last year at the very beginning of the COVID-19 pandemic, when it was really hitting Italy before it came to the United States, that there was a video of a town in Italy where the obituaries went on for more than 10 or 12 pages of people who had passed away from COVID-19. And I remember speaking with friends about the 1980s and how we were all having this PTSD about exactly the same things that we remember seeing in the 1980s for HIV, with newspapers and gay newspapers filled with obituaries of friends and colleagues who are no longer there. The other similarities that we see is the stigma that is associated with infectious disease. In the 1980s, we had the 4 H's: hemophiliacs, Haitians, homosexuals, and heroin users. And then unfortunately, stigma reared its ugly head again in the late 90s with the down low phenomenon here in the United States and stigma against bisexually active men. And then unfortunately, that HIV stigma persists. We've seen with Charlie Sheen coming out just recently that he was basically being extorted by his girlfriend to keep his HIV status secret. So this stigma is something that's enduring. And we unfortunately see the same stigma that's taken place during COVID-19 with discrimination and waves of attacks that are being leveled against Asian communities, Asian American communities, Black and Latinos who have been saying that they've been experiencing COVID-related stigma, Latino workers, particularly in meat plants who've received stigma and discrimination from surrounding towns and communities because of fear of COVID-19. The other thing that we see that is similar with HIV is we have been fairly late to recognize the differences by sex. So with HIV, remember, it wasn't until 1993 that we reclassified our definition of HIV infection and expanded it to include women. Because up until that time, it was not necessarily recognized that this was a condition that also affected women and not just men. And unfortunately, we repeated that as well with COVID-19, where at the very beginning of the pandemic, we kept talking and asking, why are men more vulnerable for COVID-19 than women? And when unfortunately, the thing that we didn't realize is that the COVID-19 recession disproportionately hit women compared to men. And that we see now that there was also a pandemic within a pandemic with intimate partner violence increasing during the COVID-19 pandemic, as well as the fact that some of the worst side effects that we see for COVID-19 vaccines are reported primarily among women. So we were late for the recognition of some of the differences by sex for both of these epidemics. The other thing that we've seen with both of these epidemics is the degree to which they have affected marginalized populations, and particularly communities of color. My colleagues and I published a very early paper showing the nationwide impact of COVID-19 in Black communities, where we found that in those counties, as the number of Black residents increased, you saw an increase in COVID-19 cases as well as deaths, and eventually found that among those counties, only 20% of counties, that nearly 52% of them had the nation's COVID-19 cases and nearly 60% of the nation's COVID deaths. And unfortunately, it's something that is enduring. There are data that CDC released, again, looking at some of these disproportionately Black, Latino, or Native American counties, where they found that for large stretches of the pandemic, that we saw greater rates of COVID-19 new infections taking place in Black counties and Latino counties, as well as Asian counties, compared to all other counties in the US. And that was been one of the really sobering parts of the COVID-19 pandemic, is the degree to which we've seen that the populations, particularly by race and ethnicity, who are disproportionately impacted by HIV are the same populations that were disproportionately impacted by COVID-19 in terms of cases, hospitalizations, as well as deaths. We also see the impact in terms of aging. We've had the benefit of ART and for people living with HIV to live longer, more fruitful lives, with more than half of us in the United States who are HIV positive over the age of 50. But unfortunately, COVID-19 really aimed at cutting down those individuals who are elderly in our society, where we also saw, again, some of these disproportionate rates among Black and Latino communities who are elderly, who are cut down by COVID-19. And we certainly have seen friends and colleagues, people living with HIV who passed away in the last year, such as Barbara Joseph, Dolores Dockery, as well as Ed Shaw, and many others that many of us know. So with that said, there still is a lot for us to celebrate. There's been a lot of progress that has lifted all boats with HIV. I mean, the first thing that we could talk about is the science and the role that the NIH has played in really advancing HIV science to a point where we really can address most opportunistic infections. Antiretroviral therapies are available to make sure that people living with HIV live long, productive, happy lives, and that we have pre-exposure prophylaxis to prevent HIV infection. And just here on the side, you could see this from this slide from 1990 through 2016, that worldwide, there's just been this precipitous decline in HIV/AIDS deaths because of the advent of antiretroviral therapy. And you could see the number of deaths that have been averted because of the advent of antiretroviral therapy and making sure that it's available across the world and not just in the United States. And within the US, you can also see that among people living with HIV, and these are data that CDC released last year, that we've seen a decrease in deaths among people living with HIV. And this decrease in deaths are HIV-related deaths, as you can see from this line here. It's not all-cause mortality, it's HIV-related deaths. So we have been making some incredible headway. And that headway has also lifted the boats for many other diseases. Of course, HIV science has been instrumental in creating the COVID-19 vaccines, our Ebola vaccines, the Hep C DAAs. We just found out data that NRTIs have been instrumental in treating macular degeneration. And then, of course, HIV science has really revolutionized rapid tests. It's revolutionized self-testing, as well as online interventions and apps for people across various diseases. The other thing that we see between COVID-19 and HIV is the way that clinicians were on the front line. So particularly for HIV, we saw that there was compassion in the face of fear, that these clinicians really took care of people living with HIV despite the panic that was enveloping the United States and the fear of touching or being close to someone with HIV. We saw something that was very similar with COVID-19. Not only were HIV doctors leading the charge for COVID-19, but clinicians all across the United States worked incredibly long hours in the worst of the pandemic to address COVID-19, where they showed compassion by using their cell phones to say goodbye to family members with patients who are bedbound, and also humanizing themselves by showing their faces as part of their gear, that protective gear would not allow patients to see. And we also know that clinicians also have a toll in the COVID-19 fight, with about 4,000 who passed away from COVID-19 in the US alone. The other lesson that we have is the power of community. And this has been brought up several times today, and how fearless and how incredible the HIV community has been. The HIV community fundamentally defined a community response by issuing person-first language, that we're not victims. We're not victims of HIV, that people are empowered in their response to HIV. And a lot of that was encapsulated in the Denver Principles. The creation of legal services by people living with HIV for people living with HIV, a buddy system for people living with HIV, food banks, speaker bureaus. It was this whole system that really defined a community response. We also transformed provider-patient relationships, with patients fundamentally in the driver's seat. Up until that time, that has never happened in the US medical system. And then, of course, there was the activism that had done so much to make visible the invisible, what was taking place, the devastation that was taking place of HIV, both domestically as well as globally, with quicker approval of drugs, increased funding for research, and David French saying that ACT UP created a model for patient advocacy within the research system that never existed before. And we're seeing some of this as well taking place with COVID-19 COVID-19 and emulated by COVID-19 with Survivor Corps, which is the largest online service for people living with COVID-19 or had COVID-19 and still suffering from systems, that provides a panoply of services for those individuals. And we also see how individuals, really stepped up to the plate and were able to make sure that HIV vaccine websites were navigable for most people across the US by fixing some of the sites in New York or in Massachusetts or other places so that make it easier for people to find a COVID-19 vaccine. The other way that we see that the community response has been instrumental is even in providing solutions and interventions. We know that needle exchange is a solution that came from the community, and this enduring solution has been helpful in so many different outbreaks that have taken place in the United States, including the Scott County outbreak, where more than 200 people became infected with HIV, as well as co-infected with hepatitis C. But as soon as the Syringe Services Program was instituted, you saw that there was a leveling off of the infections and eventually no infections that took place. So again, this community response and this innovation from the community has been incredibly effective. It was also the community that recognized that these are overlapping issues and problems that we have to deal with. It's not just HIV, but it is substance use and overdoses, it's hepatitis C, and now, of course, we see COVID-19. And we've seen how that recognition of these overlapping epidemics have taken place during the COVID-19 pandemic, with CDC issuing data that there have been increases in opioid and overdose deaths over the last year, specifically for opioids, for methamphetamines, as well as for cocaine, all of which are associated with HIV infection as well. And that there's also been spikes in congenital syphilis, particularly in our area, but in other places across the country as well, that's taken place during the COVID-19 pandemic. So there's this recognition that we've had in the HIV community that it's not just HIV alone, that it is different other diseases that coexist and also make matters worse for people living with HIV and people who are living with other chronic or other health conditions. There's also this recognition of the comprehensiveness of the HIV response and how important that's been in us really achieving some of the remarkable changes that we've been able to achieve. It's not just the individual level interventions that have been helpful. It's marrying the individual level interventions with systemic interventions such as housing, childcare, transportation, legal services, as well as some of the policy remedies to really get us to where we've been in addressing HIV in the United States. And we could see how a lot of that has been in display even in the Ryan White program. With the provision of wraparound services and how that has affected viral suppression for various communities in the United States, for Latinos, men who have sex with men, people who inject drugs, African Americans, transgender youth, people who are unstably housed, where we've seen this increase in viral suppression from 2010 through 2019. We also see in the Veterans Administration, with a premium being placed on health equity, that the COVID-19 response was fundamentally different than what we saw throughout the rest of the United States. That in the VA, that even though African Americans as well as Latinos were far more likely to get COVID-19, that they were not more likely to die from COVID-19, as we saw nationally, that health equity really helped, as well as the VA and its response to HIV, where we've seen consistently higher performance across the HIV care continuum compared to national samples. The other thing that we see that is very much similar to HIV as well is, after HIV, it just garnered so many of us who were essentially deputized to become involved in the HIV response. I certainly became involved in the HIV response after living in Brooklyn, New York, and watching so many people around me who were dying, and my father working at St. Vincent's Hospital, which was ground zero for HIV, and that's why I became interested in public health. We're seeing the same thing right now with COVID-19, with public health programs seeing a surge in students right after the pandemic, as well as medical schools that are seeing a surge in applications, particularly from Blacks and Latinos who are disproportionately impacted by COVID-19. And just gives us hope that we're going to see a new generation of health leaders. And then, as has been mentioned before, we know that what's been incredibly helpful for HIV is that it has been bipartisan for most of the pandemic, with President Biden committing more money for ending the HIV/AIDS epidemic program domestically. It's a program that was started by President Trump that also began within communities first. President Obama's national HIV/AIDS strategy, which helped define the US response, President Bush's intrepid response to the beginning of the PEPFAR program that has transformed our HIV response internationally, as well as the first HIV/AIDS and White House conferences and strategy, actually, that was issued by the Clinton administration. So there has been this thread where we've had this bipartisan support around the HIV that has also been helpful for us to getting to the remarkable gains that we've made. There's also the expansion of antiretroviral therapy to low and middle income countries, and the fact that COVID-19 vaccines are going to follow suit. Because we have been able to make sure through PEPFAR, through the Global Fund, that antiretroviral therapy is available in low middle income countries, we've seen this decrease in new infections globally. And without the antiretroviral therapy, we would not have seen that decrease. And it's been really heartening to see that we're going to be following the same suit with providing COVID vaccines now to the rest of the world as well. So I just want to close with a perspective from Andrew Sullivan, who I don't always agree with, but I did find that piece that he wrote on how to survive a plague for Americans generally. And this is for the opioid epidemic, but it really applies for opioids, COVID, as well as HIV. And what he wrote is, and this will change us, it must. All plagues change society and culture, reversing some trends while accelerating others. The one thing we know about epidemics is that at some point they will end. The one thing we don't know is who will we be by then. Now, I agree with Andrew that at some point epidemics will end, and we know that we're going to end HIV. Where I disagree, though, is that we know exactly who we are. We're the same community that fearlessly faced death for many years before there were therapies that were available. We're the same community that built durable, local, federal, as well as international responses to HIV. We're the same community that has set the standard for a pandemic response. And we're also the same community that will end HIV. Thank you for the opportunity to speak today, and I look forward to working with each of you to ending HIV. I look forward to working with the White House, HHS, and others. It's really this partnership that we've had that has been so unique for all of us to be able to actually get to the point where we can end HIV.